Hello and welcome to this video on supporting your adult patients with the artificial pancreas system. We hope that you enjoy it. Please share your thoughts in the comments section and make sure that you subscribe so that you don't miss any new content that we upload. Good afternoon everybody, my name is Hope Frost and I'm from SBK Healthcare. I'm delighted to welcome you to this webinar, Support Your Adult Patients with the Artificial Pancreas System. I'd like to thank Advanced Therapeutics for kindly sponsoring this webinar. It is now my pleasure to hand over to John Hughes, who is the Managing Director of Advanced Therapeutics. Hello, John.
As Hope said, my name is John Hughes. I'm the Managing Director of Advanced Therapeutics UK Limited. We're the UK distributor of the Dana range of insulin pumps and consumables. My job today is literally to just introduce the this webinar on the interoperable artificial pancreas system, APS for short, which is based on the CAM APS FX closed loop program and the Dana RS insulin pump. An interoperable system enables you or your patients to choose different components of a system, like the CGM, the pump, or the algorithm from different manufacturers, depending on the individual's requirements. I'm going to just give a brief overview of the Dana RS insulin pump before I hand over to Professor Hovorka and his colleagues, who will run through the synopsis of the clinical evidence for the app, which has been built up over the last 13 years, and some of the practical issues surrounding using the app in the clinical setting. So let's start with the Dana RS pump. The pump can be used in one of three different ways. It can be used directly from the keypad of the pump itself. It can be used with a smartphone via the iPhone or Android smartphone app, or it can be used as a component of an interoperable closed-loop system such as the CAM APS. On its own, the pump is very small, it's very light. It has all the features you'd expect of a modern pump. It has a 300 unit reservoir, so you can part fill that, so it's suitable for insulin resistant patients, insulin sensitive patients. In addition, it's waterproof and has bolus calculator, temporary basals, etc., a comprehensive range of safety functions. It also provides a range of infusion sets, both metal and Teflon, the newest of which is the Dana Inset 2. The key thing about the pump and why it's being used in artificial pancreas systems, if you can go on to the next slide, please. It provides secure connectivity with other devices such as Dexcom G6 CGM through a low energy Bluetooth, which enables secure Bluetooth connectivity to smartphones and apps, and also reduces battery drain. The pump itself is being used for artificial pancreas work because of its fast and reliable data handling, and also for the future, it's future-proofed because software upgrades can be provided via downloads via the app from the internet. It's currently a key component of the CAM APS FX artificial pancreas system, and because of its interoperable nature, if other systems, in addition to CGMs or different artificial pancreas looping apps become available, it would be able to connect to those, obviously as long as the manufacturers of those agree. So as I said before, you can use it on its own with a smartphone app or through artificial pancreas programs. So I think that's the pump. I think I'd like to hand over now to Professor Hovorka and his team, who will go through the app and the clinical background, as I said before, and the practical issues surrounding training and support in the clinics. Thank you,
Thank you, John, for the introduction. And it is my pleasure to take over now from John and provide more information about the use of the CAM-APS-FX, the clinical evidence, and also some practicalities. I will be joined on the journey with Candice Ward, who is a CDEP educator and also trainer, providing training material for the CAM-APS-FX. I hold a chair at the University of Cambridge, but for completeness, I also am a director of the CAM-DIAP company, which is commercializing the CAM-APS-FX. So what we'd like to do today is to overview the CAM-APS-FX app, and provide clinical evidence, provide information about some of these features, especially about the personalization features which are unique to this app, and also spend some time what are the steps of adopting the CAM-APS-FX in your clinic, should you wish to do so. So maybe we can start first about what is an artificial pancreas or closed-loop insulin delivery or automated insulin delivery systems. It generally combines three things. So it would combine a glucose sensor, which has a small probe going into the subcutaneous tissue measuring glucose every 5 minutes. That sensor with transmitter is sending the data, in this case on this picture, to a handheld device or smartphone, which will process the information from the sensor, calculates how much insulin should be given, and direct the insulin delivery to the insulin pump. This is happening in real time every 5 to 10 minutes. There are other systems available where there is no need for smartphone. The information is flowing directly to the pump, but the system which we'll be talking about is that which includes the smartphone, which allows some other functionality, as we will mention later on. So this is a real one day on a closed loop system on artificial pancreas on the CAM-APS-FX system. What you can see is on the top panel is the glucose concentrations every 5 minutes as obtained from the Dexcom G6 CGM transmitter. And at the bottom panel, you see the insulin delivery as directed by the CAM-APS-FX app and delivered by the Dana RS pump. Again, what is important to mention is here that when we can see here the glucose responsive insulin delivery, unlike in the standard setup of insulin pump. So when glucose goes up, you can see the increased insulin delivery. When it goes down, it stops insulin delivery. At meal times, such as here the breakfast, lunch, dinner, and snack and dinner, in this system, the user is expected to give meal boluses in the standard way as they would be using it in the insulin pump therapy. And the reason for it is because there is a mismatch between the speed of the absorption of carbs and the insulin action. And for that reason, people are expected to give boluses. And for the reason that we're combining the automated insulin delivery and also manual insulin delivery, these systems are called hybrid closed loop systems. So all the commercial systems which are currently available using this hybrid closed loop approach. It doesn't necessarily mean that people will always bolus. So the system needs to be able to cope, but generally if people bolus, they get a better results. So at Cambridge University, we have started this research in early 2006, and we were building the evidence and also improve the control algorithm, and also built the various prototypes. And the final system, this CAM-APS-FX, which is an app running on an Android phone, has been put into the use in 2019, but it utilizes all the evidence and all the learning which we obtained throughout this period. We have a comprehensive outcome randomized clinical data in translational research experience. And in our studies, which we started initially in hospital and control conditions, testing exercise, testing large meals, we then went into the outpatient clinics, and we in our studies, we enrolled very young children, adolescent, adults, and pregnancy, and we have outcome data, safety data, and efficacy data for these populations. So the general observation which we've seen, and these been published in high-rank medical journals, is that we've seen in the longer studies reduced glycated hemoglobin by 0.4%, decreased time in range by about 10 to 12%, reduced hypoglycemia, and quite importantly also improved quality of life, reduced burden of diabetes, and for some it's one of the key feature why people want to use closed loop system. This shows the data from our longest and largest studies with the system, and I will be skipping all the building evidence for the sake of the time. And it's data from a 12-week randomized clinical trial where we enrolled those age 6 years and adulthood. So it was both the younger generation, also adults. It was done in the UK and the US. And the graph on the top right side will show you showing the results, which are in principle very generic to closed loop systems. So what you generally see, and the pink area or the red area, you see the tightening of the glucose. This is 24 hours. So this shows the night, and you can see the separation from between the closed loop and the gray area is the sensor augmented pump therapy. So it is using exactly the same component, the same sensor, the same pump, the same insulin, apart from the algorithm. So you can see the improvements mainly overnight and also to lesser degree during the day. And overall, we see, as I mentioned, increased time in range, reduced hypoglycemia, reduced mean glucose, and also reduced A1C as well. So you get all these benefits through application of closed loop. We continue building the evidence, which allows us to provide more information for reimbursement. At present, we have about 160 active users in various randomized clinical trials. So we also compare the use of the VIAS Venaspart as well. That study just finished. We are doing study in those age 60 and above, and also pregnancy studies on the way. So at this moment, I will over to my colleagues, Candice Ward, which will take you through the details of the CAM-APS-FX system.
Thanks, Roman. Hello, everyone. So Roman's quite eloquently explained sort of the background and research, and now I'm going to go on to the practicalities of how the app works as the brain's connecting the various components to deliver and drive insulin delivery. Next slide, please. So as I said, the CAM-APS is the brains. It contains the algorithm that will receive the information from the CGM and then learn and use its functionality and its settings to be able to drive the pump to deliver the insulin that is required to control blood glucose levels. It incorporates a bolus calculator, as well as automatically uploads the readings to DiaSend, and also triggers off SMS alerts to followers. So all the pump functionality and the CGM functionality is controlled through the app, which is very useful. So you're not having to do lots of different apps at the same time. It's all in one easy functionality through your phone and the app. So very easy to set up. All it needs to start the algorithm is body weight and total daily dose. We recommend that between 5 to 7 days average of total daily dose is inputted as a starting metric. It then modulates the insulin delivery via using the extended bolus function on the pump. So it's not reading the basal settings that are on the pump. It is the extended bolus that is actually being delivered and changed every about 10 to 12 minutes to provide this blue graph that we've got here that you can see modulates very clearly according to the direction of travel that the glucose is going in, and can quite quickly respond and control and improve time in target. It takes about 3 weeks after starting the system to really hone and learn about the individual. So it's very adaptive. We all know from people living with type 1 diabetes that no one day is alike. So it's being able to cope with that variance between day and night, in women between menstrual cycles, post-meal glucose readings, as well as just being able to adapt for different times, so stressful times, maybe when you're not as active, or when you may be ill or doing some sort of more active periods of time. Next slide, please. So that's what gets onto the personalization. So the app is able to be personalized to your own settings. We are allowing glucose targets. Now the target or preset default target is 5.7. And that's often people find that is quite a good target to aim for, but you are able to change that, and you're able to also use boost and ease off as two functionalities that also almost mimic the temporary basal rate settings if you were using standard pump therapy. The nice thing as well, sorry, Roman, just go back one slide. The nice thing as well is the fact that you are able to see what's happening on your pump. So if on your app, so if you take the app and turn it sideways, you are able to see this detailed graph that you see on the right-hand side of your screen, and able to pinch the axes and scroll backwards to be able to see what's happening, now, versus what's happening maybe a few hours ago, overnight. So you have quite a bit of functionality on the app itself, as well as all that information is being uploaded to Diasyn that you can look through the detail when you have time. But having that sort of real-time feedback is very useful. Next slide. So let's talk about ease off. So ease off is about reducing the algorithm's sort of aggressiveness, and it reduces the amount of insulin that's being delivered to help with raising glucose levels temporarily over a period of time. So the nice thing about it is you can either use it now, so you can set it, if I'm going to go do exercise in say an hour or 90 minutes time, I can set it to ease off my glucose, my insulin, to be able to cope with the exercise I'm about to do. But it's also good because I can plan ahead. So a child going to school, if you know the PE sessions at 1 o'clock in the afternoon, you can pre-program before the child leaves for school that 12 o'clock ease off will commence, which is quite useful just to start planning the day ahead. So click again, please. So these are the things that we use ease off for. So before, during, and after exercise. Some people find it quite useful if you've had a run of hypos, so very hot weather or something's going on that's causing some hypos and you're at an increased risk for having further hypos. Using ease off for a period of time will help. And then for hot weather, it's very useful. Next slide. So the opposite is boost. So that's making the algorithm a bit more aggressive. About 35% more insulin is delivered. And this really helps get the glucose quicker down to target. You can, again, just like ease off, set it now or set it for later if you know the periods, say, of time that you need it in advance. Just click again, please. So the things that we find are useful in the clinical practice is sort of for the premenstrual period. Some adolescents find that they get growth hormone pulses, and it might be quite useful for those stages. If maybe you've miscalculated carbs, or you've had quite a high protein, high fat meal, and post meal you want to bring those glucose levels down quicker, you can use boost to just assist the system to be able to bring those levels down. And then for illness, we recommend that if you are ill, that you are producing ketones, that you revert to pump in sick day rules. But if it's low grade, not triggering any ketones, so it's a stressful period or just a little sniffle or something like that, you're just running slightly higher, it is worth using the boost functionality. And this, you can see in the bottom right hand corner, you can see the red is boost on the graph, so overnight boost is being used in this circumstance, and the yellow two bars on the far right are ease off, so you'll be able to see what's happening both on your app as well as on Diasend to be able to look back when these circumstances are occurring. Thank you. Next slide. Personal glucose target. So this is being able to sort of personalize. So as I said before, your default is 5.8 that the algorithm is aiming for. But you can set it at different points. So, you know, maybe you want to ease off overnight and set and have the default aiming for slightly higher, slightly lower during the day, or it depends on the individual. The minimum we allow the personal glucose target is 4.4 up to 11. And it's quite useful if you find that, you know, glucose variability has been very low, we've been very stable, you might want to lower the target. We do lower the target in pregnancy to get the outcomes we need. And if there's been a period of high, sort of lots of hypos, you may want to raise the target for a period of time just to allow things to settle. In our experience, a lot of people do play with the settings, but actually find that the 5.8 is quite a good target to start off with. You'll see this little round ring is showing you a little icon, like a target, bullseye icon. And when that's showing on the app, it's showing that you've got a personal glucose target set and sort of different to the preset target. So just reminding you that that's in place. So I'm going to hand back to Roman. He's going to talk through the comparison between the three systems that are available currently on the market, just to sort of identify where the differences occur.
Thank you, Candice. Lovely presentation. In the UK, we are fortunate enough to have three systems available for use, and then we will have another system, the one from Medtronic, the 650 as well coming. And this provides a comparison, some of the features, and not of the clinical data, but some of the features which are available for these three systems. So this provides comparison of the features, not of the clinical data, which it's a separate issue on the clinical data. So the CAM-APS-FX is available from the age 1 year and up, including pregnancies, whereas Tandem is from the age 6 years up, and 670G from 7 years up. Both Tandem and Control IQ, Tandem Control IQ and CAM-APS using Dexcom G6, which is very well accepted because it's a non-calibrating sensor, it's factory calibrated, and it has advantage for both utility and also the cost. One saves money on the strips as well. 670G, because it was the first system, it was really it was designed mainly for safety. It has a lots of or number of auto mode exits, where for various reasons the pump stops the closed loop operation. This doesn't really happen in these two systems, CAM-APS-FX and Control IQ. For the settings, for the system setup, the CAM-APS-FX need just total dose and weight. Control IQ is really non-adaptive system, and it will modulate insulin rate based on the basal rate, insulin to carb ratio, and also correction factor. So they should be really set to properly, approximately correctly for the system to operate optimally. This is to a lesser extent correct for the 670G, but it also the automated the operations of the auto mode depends on the setting of the pump. The CAM-APS-FX is learning the overall insulin needs. It's also learning how these insulin needs change over 24 hours. And it also learns whether the meal boluses, the insulin to carb ratios are correct or not, and it can complement the additional insulin if it is needed. So it will not change the insulin to carb ratio, but it gives more bolus. The Control IQ doesn't have any adaptive component, and the 670G is learning the overall insulin needs. With the CAM-APS FX, you can always edit privacy from the phone. CAM-APS FX has the wide range for the personal target between 4.4 and 11, which can be mentioned. Control IQ has the overnight target, so one can make it tighter, and the 670G doesn't have a additional target apart from default. The active insulin time, it's learned, it's adapted all the time with the CAM-APS FX. With the control IQ, it's for safety reasons, it's set at 5 hours. And in 670G, it's an important factor of how to tell the pump how much aggressive it should be. So the shorter active insulin times generally results in higher responsiveness and vice versa. The activity mode or the exercise mode is available on all 3 systems. Again, with CAM-APS, you can plan it ahead. You can plan it a few hours ahead if you know something is happening. The boost mode is available only in the CAM-APS FX. The remote monitoring at CAM-APS FX is with the texting to the parents or guardians' phones. We're planning the followers as well. Dexcom follows integrations late in 2020. Control IQ has also followers already embedded in the system if person has a phone together with the pump. I think which is really nice feature is that through the CAM-APS FX, the data flows behind the scene seamlessly all the time to Dialsen. So for healthcare professionals, you get the data directly to Dialsen. You can look at it in your clinics. There is no need to connect the pump to any device. It's happening all the time. And additionally, the CAM-APS FX is also approved not only for rapid, but also ultra-rapid insulin. And as I mentioned, we just finished one study with FIAS and with the system. So where we are with the system, the CAM-APS FX is CE marked, so it's regulatory approved for type 1 diabetes. And as I mentioned, it is approved from the age 1 and up. And during pregnancy, it has a pretty wide range in weight, and also total daily dose. Tandem control IQ is more limited. I think the maximum for total daily dose is set around 100 units. We are using, just to let you know, we are using this system in type 1 diabetes in various conditions, including gastroparesis, so we can set up higher target glucose range for these people. They also generally need more insulin, so it provides a high flexibility to use it in various special populations as well as normal type 1 and the standard type 1 population. I will jump straight into some of these aspects about adopting the system. So this is the cost. The cost is the same for those people who self-fund and also for those who get it prescribed through the NHS. So the annual subscription is £840. Again, we have for those who self-fund, we can also have a monthly or 6 monthly subscription. And I just want to mention the CAM-APS FX is commercialized by the company CamDiab. It doesn't have any other income like the other pumps, so these costs reflect the means to sustain the business and to grow and innovate as well. As I mentioned, there's a possibility for those who are able and willing to provide funding for self-fund for the app. We taken orders on the website camdiab.com. There's an online process where they can provide few information and subscribe. They would be expected to have a Dexcom G6 and also Dana RS pump. I just want to mention is that both John Advanced Therapeutics and also us, we provided 1 month free trial. So if people want to trial the pump, it is possible. And similarly, they can no string attached test the app. No such things apply to Dexcom G6. So you would need to have a G6 available from Dexcom. The user need to complete the online training, and Candice will be talking about it. We have quite unique training provision for the app. and the app is just downloaded straight away from Amazon App Store. It's unlocked using the training code, which people obtain when they finish training, and up they go. So in principle, they actually don't need to get a training for healthcare professionals. They can get a training from on the app directly through the online training platform. So we started commercializing in March 2020, so it was just before COVID, and we try to streamline the adopting the app within the NHS. So if your trust is seeking funding to provide it within NHS, we can help you with providing health economic analysis, which we develop, and we can share with you to share with your CCG, with your trust. We can also provide a business case template, which will need your trust details, but there is lots of justification, all the data which are behind, and also the justification, the benefits which are obtained through using the app, reduction of A1C, improvement quality of life, reduction of hypoglycemia. If you look at the cost justifications, if you look at the closed loop system with the CAM APS FX, with the Dana RS pump, and there will be also new Dana pump as well coming, the Dana I, and also using the Dexcom G6, the whole package will come about 1.1K cheaper per year per person compared to 670G based closed loop system. So this is the information which is also provided in the health economics analysis. Currently, the app is available in number of trusts in the UK, and we are working with number of trusts, and you should reach to me or Candice to help you with that. And these are the trusts which are available, and sometimes it's a mixture of things. So, for example, in Edinburgh, it's mainly IFRs, but in other trusts like in Manchester, that is widely available there as well, including Nottingham in the pediatric populations. I will leave it here, and actually I will mention quickly we provide also support, technical support. The clinical support is we try to provide where we can, but you were expecting for your patients, you will be providing your own clinical support for managing type 1 diabetes, but we are very responsive where we can to provide so. Candice, could you take it from here, please?
Sure. No, thank you very much. So the CAM Diab website is available to find information. We are going to be adding extra sort of user experience stories, business cases, templates, just to provide you with as much information and sort of business case and templates to be able to implement CAM APS in your clinic should you want to. It is also a place that you can either telephone or email to be able to ask questions or ask queries. But the one thing that we are able to provide is quite a bit of online support. So next slide. So we utilize, I don't know if you're aware, the Cambridge Diabetes Education Program is an online training platform for diabetes aimed at healthcare professionals that we run out of Cambridge University Hospitals as well. And we use the functionality behind that e-learning platform that has now trained over sort of 25,000 healthcare professionals to clone the learning and the academic underpinning to develop the online learning for CAM APS. So it is an online training platform that serves the purposes of training healthcare professionals around the functionality of closed loop and the app, as well as people who are living with type 1 diabetes and wish to use the system, their family and friends and carers, but also school staff. So everyone can go online, it's completely free to access and do training in their own time, and especially in this COVID era, it really helps prevent delays in treatment because people are able to do the training. The feedback we've got from people who've used the training is excellent. They really enjoy being able to do the training in their own time, as well as being able to go back and reflect on that training, maybe look at questions again. So it is competency based, so we expect people to undertake the training and pass. Our pass rate is 80% to make sure that people understand the process. We know that it's boosting their confidence and familiarity with how to utilize the system and troubleshoot. And it also generates a certificate and a reflection document that healthcare professionals can use as part of their revalidation and appraisal process. But importantly, it generates a specific unique code that unlocks the app. If you don't have that code, the app won't unlock, and therefore you can't use it, just as a safety feature. Next slide, please. So if people register, there is one essential training sort of topic that they have to complete to be able to get the unlock code. It's clearly identified. So healthcare professionals and patients get the exact same training, and so you can go through it. It takes approximately about 45 minutes. You don't have to do it in one go. You can log in and out from your mobile phone, from a computer or on a tablet, and complete it and generate your certificate. We've also found that people from feedback have found it very useful to have potentially some pre and post training. So we offer carbohydrate refresher training. We also offer Dana pump refresher training that can be done before or after starting the system. And then we offer optimization or fine-tuning training that should be done about 3 weeks to a month after starting the system. So by that time, the system's adapted and learned about, you know, your needs or the patient's needs through the day. And so time in target should be improving and getting where you want to be. But if it's not, there are a few key things that need to be addressed. For example, carbohydrate counting, set changes, sort of practical running tips about using the system, when to start ease off and boost and things like that we find is useful to refresh at that point in time, as well as the school's training is available. Now, should you wish to see the training app, you can just use the QR code that's in the corner there, and just scan, and it'll take you straight through to the portal that you're welcome to register and have a look at. Next slide, please. We also are offering a series of very practical webinars. So they run on the first and third Wednesday of the month in the evening between 6:30 and 7:30. And these practical seminars are just aimed, or webinars are just aimed to really troubleshoot those issues. So we've had the first one, the recording is available on the CAM APS platform. And that was just introducing the system. So similarly to what we've done here. And we've got one next week about the practical tips about making starting as seamless as possible, and really just going through the button settings that be useful. Optimization is the next one. We're going to be running through schools training and also then fine tuning. And in the new year, we'll be doing things on exercise, food, and sort of what you do with different sort of the pizzas and the curries, as well as a number of other things, refreshing the Dana, especially when the new Dana I comes out. You know, what is the differences? They are very, very similar pumps, so don't get sort of stressed about it, but there are just some definite improvements to some of the systems that we would like to run through with you, just to help your familiarity with the system. Next slide. That brings us to the end. So we'd like to take some questions. I've been seeing questions pop up. Roman, I'm sure, is going to join me on the screen, and John as well, that we can just run through some of your questions that you've had for us and answer them.
That's brilliant. Thank you so much, all three of you. That was wonderful and very insightful. We have had quite a few questions, so I will start with, for ease of pre-exercise, does this need to be started when exercise starts, or say an hour in advance, as we would with the standard pump therapy?
Shall I answer that?
Yes, please go ahead.
I will. So with as you know, exercise is very, very variable. It depends on what type of exercise you're doing. It depends for how long you're doing it, as well as what your starting glucose levels are. So, you know, what are your trends? So I think the fact that you've got all of that information at the, you know, at your fingertips on the app will help you determine when you start ease off. I think if you're very high, you may wait a little bit, but ideally we say probably about 90 minutes before starting exercises when you should be thinking about starting ease off. And then depending on the length and duration of the exercise, you may want to run it for a period of time after. But I think that's why we're wanting to run these practical webinars, giving you different scenarios of this person's doing football and they've done this, this and this person's doing something else. I think the important thing about exercise, if I'm going to talk a little bit, it's one of my favorite subjects, talk a little bit more about it, is not having a big carb dose before you start exercising. The algorithm will anticipate that glucose level rising and will increase the insulin levels. So we shouldn't have big carb doses before you start exercising, that drizzle in effect, which we generally are recommending in any case in type 1 diabetes and exercise management, of drizzling in the carbs every 15 to 20 minutes, depending on the exercise, is much better than sort of preloading the carbs at the beginning.
Okay, thank you, that's brilliant. So the next question is, does the boost/ease off need to always be input, or does the algorithm learn this? For example, if a patient was going low during the night.
So boost and ease off are for different circumstances. It's not for routine daily life. So the algorithm learns your habits. So if you are doing things like, this is my habit and I go for a walk, or I'm doing something every day, it will actually learn those routines. It's when I'm sick, or when I've sort of got some PMT, or maybe it's very hot and I need to do it for a short period of time. So boost and ease off are the extra cherry on the top to insulin management, rather than if I'm going hypo every night, the system will learn that and prevent that from happening. Unless you've obviously given yourself a massive dose of insulin, you know, and over insulinized. I think the system, once that insulin's in, can't pull it back out again. So it won't prevent every single hypo, but if there's a hypo pattern, it will prevent that. Okay, Roman, are you happy with that, or would you like to add anything more there?
Absolutely. Thank you. No. Thank you, Candice. Brilliant. Agreed.
That's wonderful. Thank you. The next question is there NHS funding for APS?
So behind the scenes, there is some discussion of wider funding for the artificial pancreas system. At present, it is CCG by CCG in the same way as pumps. So if you're interested in providing artificial pancreas up in your clinics, you need to reach out to your trust, to your CCG to justify the funding. As I mentioned, it could be done through different routes. It could be done through IFR, so it could be done through trying to find a wider reimbursement for those who already have pump and CGM. It would normally for these based on the benefits obtained with closed loop system. And as I mentioned, if you're already using 670G in your clinics and it's already available for your patients, as I mentioned, the current APS-FX system is basically similar type of closed loop system, but it's cheaper, so there should not be a reason why not to use it.
Okay, wonderful. So someone has written, presumably clinicians would simply log in to Diasend and review the data in clinic or remotely.
Am I taking it?
Yeah.
Yes. So Diasend is updated every about 5 to 10 minutes. So it is, we can't say real time, but it's as close to, you know, being up to date. You can log in and see via Diasend. It also uploads at midnight to the CAM APS FX cloud, and the clinic can be provided with this data as well. So there are 2 routes that you can see the data.
Yeah, if I can just add it, we didn't mention the presentation. We have our own cloud, which provides some additional information such as closed loop usage, the average number of alerts, etc., which helps you to look at those who need support in real time and those who can be left alone for longer. Yeah.
Okay, wonderful. What is the cost difference versus the Tandem or Dexcom system?
Yeah. So if you look at so there are 3 systems in the UK. The cheapest currently is the closed loop system with Tandem. The most expensive is the 670 Medtronic based system and the CAM APS FX system. You need to take all 3 components, and I just want to mention it because compared to Medtronic, where Medtronic is supplier, with the Tandem, it's both Dexcom and Tandem is supplier of the where we're supplying Tandem in the UK. For the CAM APS effect, there are again it's a number of suppliers, but if you take the whole all the components, we are somewhere in the middle, closer to the Tandem, but it's the Tandem Control IQ is the cheapest at present.
Okay, thank you. Does Android APS work with any other pumps?
I just want to mention this is not Android APS. Android APS is the DIY system. This is CAM APS FX system. So if the question is what the CAM APS FX system, currently it works with just the Dana pump. It has been designed to work with different pumps. There are discussions to expand on the connectivity, but at present we are still to working with Dana pump, which is very light pump, has lots of benefits, but the discussion is ongoing.
And just jump in there, it will also work with the Dana I. When the new Dana I pump comes out, it will work with that one too.
Okay, wonderful, thank you. Is NICE planning to review hybrid closed loop systems? Does anyone know?
So what was the question again? So I missed that.
Is NICE planning to review hybrid closed loop systems?
Very good question, very nice question. We actually reached to NICE and they said there is not enough evidence, and I am flabbergasted by that. And the reason is because quite often NICE come with the evidence or the suggestions only many years after these devices are included, and by the time the diabetes tech have moved for another 2 generations. So it is frustrating, and I'm sharing my frustration very openly here. It is disappointing. So I'm aware. I think there is a discussion that they might review it for the adults. I think that's ongoing, but not for the pediatrics. But yeah, so yeah.
Okay, thank you. I've answered that one. This one is for John. Is the fiddly insulin reservoir going to be improved on the new Dana pump?
I think the filling mechanism will be made a lot clearer, a lot easier to make sure that it's been done correctly. So we've got good expectations from that.
Okay, thank you. Have there been connectivity problems between phone and pump? Would the pump then resort to its own settings? You don't need the settings right for CAM APS, but do they need to be right in case CAM APS fails?
Yes, I think that's a very good question. So I think the basal rates, the correction factor, and the active insulin time, which are 3 things that the CAM APS will, as part of its algorithm, will calculate and deliver when it's working, but they do still need to be set on the pump. The pump can't have them set at 0, for example, because should the CAM APS come out of its auto mode for a period of time, or the person chooses to switch it off, then obviously the pump will revert back to open loop, as in functioning like traditional pump therapy. However, if there is some signal loss, the pump generally, the algorithm generally can carry on delivering insulin for a period of time as it's forecasted delivering, and it will continue to try re-establish the connection. I don't know, Roman, if you want to talk a little bit more about what happens then.
And I just want to say one of the really great benefits of the Dana pump is the excellent Bluetooth connectivity. It is really good. Again, there are periods when there is no connectivity, and then the system will drop into the open loop, which is the predefined basal. So that needs to be set up reasonably well. We had one of the population we studied was those who were from newly diagnosed teenagers, and there was the ramping up of the insulin delivery. So from time to time, the basal needs to be updated based on the overall total daily dose. So this is one of the things which should be addressed on the 3 monthly visit, just to make sure that the basal setting is in a reasonable way. At present, in our usage, we will see the closed loop use is on average is used about 92% of the time. So most of the time, people will be in the closed loop. This is the average. There are people who are less, so it is individual, but it's one of the things which needs to be taken into account.
Okay, that's great. Thank you. So please do keep your questions coming. We've got about 5 more minutes to answer them. So if you write them in the question and answer box, then we'll be able to get through those. So the next question is, are there any ongoing trials for which you're looking for recruiting sites?
Right now, not. We really, especially when COVID-19 is challenging. So right now, we actually we covered all the sites. There might be just one study where you might reach to Professor Helen Murphy. She is doing closed loop studies in pregnancies. So if you reach to her, she's based in Norwich. She is trying to expand, or she's been trying to expand. So if you reach to her, she might be help you, and then or you might be able to help her on that.
Okay, that's wonderful. Thank you. And just while we wait to see if there are any more questions coming through, did any of you make any have any more comments or things that you would like to highlight today?
I just want to mention, if people want to get more information about the reimbursement, please reach to us. We would be happy to support you, either me or Candice. Yeah, I think it's important. These are important. These are one of the more challenging steps. And please come and see the webinars, and also engage in the online training, which can provide more in-depth information. It's well accepted and well used by a number of clinics. I don't know if Candice or John to add anything to that.
Go for it.
Sorry, we've got a few more questions coming through now, so I'll go back to those if that's okay. So can the system learn day-to-day variations such as weekends versus weekdays if activity levels are different?
Yeah, maybe I take this one. Currently, we don't have a weekdays and weekends division. It's a good question. We don't have it, but we have. We try to learn the 24 hours variation insulin needs. But these are one of the things which we are considering for the. We are continually improving. We are making changes to the algorithm. So these are some of the things which are being considered.
Okay, that's brilliant. Someone has asked, when will the Dana eye pump be released?
We understand that the first shipment is leaving the manufacturers tomorrow, and we'll have it in the country on the 23rd of October. And we'd like to get familiar with it a bit first, because we've only seen pre-production models so far. So probably from beginning of November, we'll be actively showing it around. Okay.
That's brilliant, thank you. Someone's asked, is the online training free?
Yep, no, it's absolutely free. So it's worth, you know, if you're wanting to learn a little bit more, find out a bit more about it, register, have a look through, do as much or as little training as you want, and just experience the system. And all our contact details are there, so you can give us feedback or ask your questions that way. I did see there was a question around over using boost. So a lot of people are sort of using the boost functionality sometimes instead of getting the carb ratios and their carb counting right, which was one of the comments that was coming through. And I do agree with this, which is why we have created that optimization post starting the CAM APS system to get some of those settings right, the carb counting and the webinars, to just get people to use the settings in the right way and at the right time. So, you know, recognizing that bolusing needs to be done ideally 10 to 15 minutes before you eat, just the same things as you would do in traditional pump therapy. It is not a magic wand. It's a brilliant, you know, piece of tech, and it will continue to develop. But you as a user need to also, you know, work with the system.
Okay, that's excellent. Thank you. Someone's asked about where the resources and online training can be obtained. Will you send us the details and we can forward them around for you to everyone?
No, absolutely. So there's a QR code as well as the web links on the presentation and the slides that you'll be sending around. So you can do that, or you can just you know, Google if you want them now. If you Google camdiab.com is the website address, and you can find all the resources and the training via camdiab.com. So C-A-M, I can't spell anymore. BIDA.com.
Okay, wonderful, thank you. And then the last couple of questions that we've got through is, how easy is it for clinics to start offering Dana pumps?
You know, the most difficult things is get the reimbursement. And if you have somebody who is willing to self-fund, the way it would go is that you should, as a healthcare professional, get an online training. I would suggest that your user, prospective users, gets an online training, and that's all what is needed to get online training. Take it from there. Again, obviously, your clinic should be supporting Dana RS pump and also Dexcom G6. So that's the step which needs to go through. So the biggest training burden is, or the need is usually on the pump, and it's not just Dana pumps. Any pumps, it takes longer. Is the Dexcom G6 is relatively simple to train, and similarly the up is also simple to train, but people still need to do the training.
Okay, that's wonderful.
Can I just add though, in terms of getting a Dana pump, it should be available everywhere. Unfortunately, some people do have problems because there are fairly restrictive tenders or formularies or various other lists that are involved. But a lot of people, even though if the pump isn't on a tender, the NHS does allow off-tender purchases. And we've found in the past that nothing succeeds like sheer persistence. So if you're having trouble getting funded, getting the pump funded through your health centre or clinic, give us a call and we may be able to help. It may be just the lack of familiarity, and we can provide full training and support, individual patient training and support with the clinic's backing. And there's plenty of backup videos available on our website as well. Okay.
Perfect, thank you. So the final question is, has IPS been used in labour and delivery? How does the algorithm change?
You know, it's a very interesting question. It has been asked. It has been used because of the demand of the mom to be, because they said we are not parting from that. So there's actually Professor Helen Murphy actually used the app, or the previous version of the app, and the same algorithm in previous studies, and there were a number of moms which took it throughout the pregnancy, delivery, and also post-delivery where the insulin needs drops. So it has been used. You should be able to find a paper about it as well. I think there's a paper from Professor Helen Murphy about it. And the ongoing study is taking, again, the moms throughout the pregnancy, also through the delivery as well.
Okay, that's excellent.
Hope, can I answer that last little question? I think it's quite a good one, about if the carb counting is continually incorrect, will it confuse the system? I think that's a really excellent question. We find that we obviously recommend people announce the bolus, do it 10 to 15 minutes beforehand, carb count appropriately, you know, for the best time in target. That is absolutely the way to go. But we've done a number of studies with, for example, teenagers who we can see actually, we know they're grazing throughout the day and there are no boluses going on, and the system copes remarkably well with it. Obviously, the targets aren't as tight as they would be if they had pre-announced the bolus and delivered it, but the system is able to cope very well. And then just quickly, there's one thing about learning disabilities. The system does have a block functionality that allows people, so for example, young children, the phone has to be with the app, has to be within 6 meters of the pump. So it allows people, so if somebody is using it as a phone, but maybe in a vulnerable sort of patient group that you don't actually want them doing any boluses or changing settings, that you can actually cause that, you know, put that block on for safety features. So it is quite useful functionality to be able to, you know, offer it to a wide group of people.
Okay, that's brilliant. Thank you very much, Candice. So that brings us to the end of today's webinar. I'd just like to say thank you to Candice and Roman, and to John and Advanced Therapeutics for sponsoring the webinar. It's been really insightful. We've answered lots and lots of questions.
Thank you. Thank you.
Thank you. Thank you.
Thank you very much.
Thank you.